All right, so we've heard from a lot of really smart people today. So today, or right now, I'm going to talk about marketing. So we're going to take that smart talk down just a little bit. I'm going to share with you a little bit about our background and our experience. And I think that we're all facing very similar challenges. Right now, there's overwhelming number of options to communicate with our customers and our patients. And our customers are busier and more overwhelmed than ever. So regardless of whether it's a small business or a large business or whatever it is you sell or make, we have to be focused on a return on investment as well. So today, let's see, make sure this is working. Here we go. All right. I have a few goals today. I want to share a little secret. I want to share insights on a digital content and delivery platform that you may not be aware of. This content platform can help you reach your customers when they are most receptive to your healthcare message and product-related message. I also want to describe for you a unique point-of-care patient and customer engagement system that's specifically valuable for health-related products and services. And I want to do this by sharing a story based on our experience. This demonstrates how this digital content delivery platform and our point-of-care program work together to build new business and to increase customer engagement. But before I share our story, I want to give you a little bit of insights and background and frame our narrative a little bit. We exist in a space that makes and distributes one of the most important pieces of technology a human being needs. Yet it's probably the one piece of technology not a single person wants to buy. It's important in demonstrating this and how we overcame these challenges in an industry that struggled to realize any kind of significant growth and has forced us to design and develop new marketing solutions that actually created a whole new business for us. So what is our background? We've spent about 35 years in the hearing healthcare industry. We've done everything from manufacturing, distribution, audiology services, auditory therapy. We've worked with consumers, distributors, retailers, audiologists, hearing care dispensers, and other health-related businesses and service providers. So what are we faced with? What's our industry realities? There's 15% approximately or more of the US that's currently dealing with hearing loss. 1 in 5 children under the age of 12 currently has a measurable hearing loss. There's significant evidence that untreated hearing loss poses a great risk to our overall health care. Boomers are hitting 65 at a rate of 10,000 people per day, according to AARP. And hearing loss is really an inevitable part of aging, the aging process. Society pushes us to accommodate the maladies of aging, so you'd think that most consumers would be quick to adopt a solution like a hearing aid. Not even close. The hearing aid industry has seen anemic growth, 3% annual unit sales over the year. And in 2012, they had actual 0% revenue growth. Why is that? Why is it that we are so afraid to address the issue of hearing loss? There's a psychology around hearing loss like no other sensory loss. Hearing loss challenges the core of who we are. It compromises our ability to understand, to be included, and to participate. And with the exception of food, water, and shelter, there is no greater human need than that to feel connected, to feel a sense of belonging, and to feel loved. And without that, we simply do not thrive as human beings. So why are people so resistant to seek solutions for hearing loss? It's simple. It really freaks people out. When we think about hearing loss, it freaks us out. Hearing loss is all about interacting. It's about two people engaging with each other. It's a selfish condition. It allows others to accommodate it. So having spent decades observing the barriers that keep us from adopting solutions, we've had to make a shift in thinking, how we market, when we market, to who we market, and the messages that we use. So what's the point of sharing this background? This paradigm shift that we've had to make in our own industry has created the development of new marketing solutions. We've leveraged emerging tools, we've applied them to our unique industry, and ultimately built an entirely new business around it. For our own business and in an effort to help our audiology customers, we've developed tools that allow us to target our customers with precision. So I'm going to start with this story, and this is based on a real client scenario. As I go through this story, think about your own product, your own service, your own business, your industry, and your market segment, and how might these solutions apply to your business. So, this is a story about Carol. Carol is a doctor of audiology who owns a practice, and she recently opened a second clinic. She needs to grow her patient base. She's taken on debt to open the new clinic. She's hired a new audiologist. She understands the risks that she's taken. But she's confident she can generate the business to grow her new practice. So Carol creates an ad to run in the local newspaper and to put on her practice's website. The ad follows the fundamental strategies of the industry. She loves it, and she cannot wait for these new patients to walk through her door. Fast forward 3 weeks. It's an empty waiting room. Carol's ROI forecast estimated that she'd be able to see 68 new patients. She could close on 75% of those and sell 13 new binaural hearing aids. Unfortunately, her forecast was off. The result of her ads generated only 2 new patients. She feels confused, discouraged. She's not sure what to do next. Traditional advertising and marketing messages that she used had produced acceptable results in the past, but times have changed. Patients are inundated with messaging from the new businesses in the area, which is exploding, and Carol is fighting for potential patient mindshare. Add to that challenge, she's fighting for a mindshare with a product that's expensive, it is not covered by insurance, and nobody wants it. So remember the psychology I talked about, what keeps us from addressing hearing care and adopting new solutions. Carol knows she has a serious challenge. So what does she do? She does what we're doing here. She's networking. She calls her friend Lisa, who's also an audiologist and a clinic owner. But Lisa has been experiencing significant growth over the last quarter. Carol expresses her concern and frustration over the experience she had with her ad, and the challenge in finding new customers, and the challenge she has in engaging her current customers at a deeper level, in upselling them and generating new revenue from those patients. Lisa shares with her that she attended a recent conference and that she heard about 2 new digital content platforms that leverage the time that her patients spend in her waiting room and also leverage the time that patients spend in physicians' waiting rooms. So Lisa's taken a new approach to her marketing and to her messaging. She's layered these new digital content strategies with her overall marketing plan and has helped her achieve measurable growth. She has seen growth over the last quarter and has seen growth over the last year. So Carol takes her advice. The next quarter, she implemented a layered approach, tapping into the power of these new digital content platforms, and her practice is healthy and growing. So you've heard Carol's story. So let's talk about what are these digital content technologies, how have they helped our audiologist build her practice. So let's first take a look at Carol's messaging, along with the messaging that many audiologists in the industry use. This is a typical hearing aid clinic's ad. It focuses on the value of the audiologist service. It focuses on hearing aid cleaning, ear inspections. Sometimes they talk about ear wax. The problem with traditional messaging in this space is that it assumes the target customer, the ones we're trying to reach, live in the same paradigm that the traditional buyer has. But the typical buyer is somebody who's reached the point of acceptance, whose family has finally pushed them in that audiologist's office and is psychologically ready to commit to a hearing aid. The problem is this is a really small percentage of the potential customer base in order for people to grow their businesses. Potential customers that have reached the point of acceptance simply do not relate to the messaging. And placement of the messaging in the paper does not leverage any authority of influence that will help break through the target customer psychology and keep them from taking action. These are the typical reactions to ads like that. I'm not deaf. That's for old people. So the fun part is this: by making a small shift in thinking and the beliefs about how to reach our target customer, and tapping into the power of video as a platform and pinpointing the greatest opportunity for influence and persuasion, we can effectively break through the psychology barriers that keep our target customer from taking action. That's our greatest competitor, inaction. So now we're going to take a look at a video ad that's been designed specifically for this new digital platform. That message challenges the viewer to think differently about hearing loss. Untreated hearing loss is not a harmless condition. It's a disease state with serious negative consequences. It's an indicator often of undiagnosed conditions like cardiovascular disease and diabetes. It's not news that video is powerful. Power to engage people emotionally, it simplifies concepts, it delivers content in a way that persuades people's beliefs. Both the print ad and this video ad intend to do the same thing. They intend to inspire patient action. Unfortunately, the print ad does not have nearly the impact the video ad has. The video ad is clearly more impactful, more inspiring, and more emotional. So we've talked about what we're saying. We've talked about how to take that important message and use it and deliver it via video. So now let's talk about where we present that message. So using our narrative again, Sharon just sat down in her doctor's waiting room. Sharon, our patient, has just stepped into her physician waiting room, sits down, and she notices the TV. She's engaged and curious about the information that's presented, which also includes health and wellness information. But she sees that bold video on heart health and hearing loss. She thinks about her own hearing, and during her appointment, she talks to her primary care physician about the risks and the other health conditions that are related to hearing loss. What we've done here is that we've taken traditional hearing aid messaging, we've scrapped it, reworked the conversation with the target customer to be about the disease state of hearing loss. We've redirected the focus from hawking a hearing aid to a discussion about healthcare and wellness. We've then formatted that message into a powerful emotional video platform, which helps to break down the psychological barriers that keep people and expose the risks of ignoring hearing loss. We present this content in a location that leverages the massive influence of the physician. By placing the video content in the physician's waiting room, we leverage an implied endorsement and completely reframe the conversation to be about preventative health care rather than getting a deal on something the target customer doesn't want to buy and doesn't think they need. To continue our narrative, Sharon's doctor agrees that she should have her hearing tested. Sharon's jotted down the name of the audiologist listed in the video she saw in the waiting room, goes online, and makes an appointment. Going back to the goals of the session, so I've shared the secret. We've provided insight on this digital content delivery platform in the physician's waiting room. To continue that narrative, let's take a peek at a unique point-of-care customer engagement tool. So our digital content then got Sharon to take action. She's made the appointment, but is she ready to buy yet? Sharon's nervous about seeing the audiologist. She knows it's important, but is still hesitant along with millions of other people, and is not quite ready to admit that she has hearing loss, and that may be a reality for her. She's afraid she's going to be labeled old if she has to wear a hearing aid. Even with the invisible one, she feels a little bit of discomfort in thinking that she has to put this on. What about the cost? What if she doesn't like it? Well, luckily for Sharon, she's called Carol, the audiologist that we've heard about, who ran the digital ad in the doctor's waiting room. Carol also has taken her colleague Lisa's advice, and she's subscribed to Hearing News Network, which is a digital point-of-care patient engagement system with content that has been designed specifically to reach the hearing health customer. So our patient, Sharon, now walks into Carol's office for her first audiology appointment. As she takes a seat in the waiting room, she again notices the TV. As Carol wraps up with her previous appointment, Sharon has been watching Hearing News Network. This has prepped her for her appointment with information on what to expect, insights on the process, hearing aid technologies, and tips on questions to ask her audiologist. She is now calm, educated, and prepared, and she's ready to buy. Sharon's appointment goes so smoothly, and she felt so comfortable, she immediately jumps online when she gets home and posts information on Carol's practice and her decision to move forward with the hearing aid fitting. She likes Carol's Facebook page, and she shares a couple articles that Carol has written. Sharon picks up the phone and calls her sister, whose husband Ryan has a history of cardiovascular disease and is showing signs of hearing loss. As Sharon navigates the process of being fit with her new hearing aid, she's back online, and every time she goes to the audiologist, the content on Hearing News Network is constantly updated, fresh, and relevant. Sharon's friend Margaret sees her posts and shares information with Tony. Tony then calls Barb. Barb then calls Joan. Joan emails her dad, who messages his sister, who makes an appointment with our audiologist friend Carol, and so on and so on. Carol has tapped into the power of engagement with each touch point in her waiting room. She deepens her relationship with her patients and their families. And so the power of influence carries on with very little additional investment. So to recap, we have taken the strength of digital media, we've leveraged the influence and persuasive power of the point-of-care location in the physician's waiting room. We've reworked the message to align with the mindset of the viewer in the physician's waiting room. We offer remarkable tools for hearing care professionals to break that psychological barrier that keeps the potential new patient from taking action and seeking their services. This is the point-of-care digital content program. We then coupled that with our hearing care patient engagement program, Hearing News Network, which helped Carol engage at a deeper level with her patients, increase customer loyalty, reduce product returns, increase revenue through upselling, and take the perception of professionalism in her clinic to a whole nother level. This point-of-care program can also be tailored for optometrists, dentists, chiropractors, any clinic or business looking to engage a customer at a deeper level at the point of care or the point of service. So why does this matter to you? How does this apply to your business? Well, there's 3 key takeaways here. We need to think differently about the message, the method in which it is delivered, and the location you present it in order to grow your business. Tapping into the power of digital content delivery systems that leverage the persuasive strength of the video medium, along with the influence of the physician's office and the mindset of the physician's patient as they wait, creates new opportunity, it expands brand awareness, it educates a population, and creates new customers, ultimately having massive positive impact on every customer that message reaches. In recent studies, there's indication that consumers are spending much more time in point-of-care venues, where they're eager to receive supportive information and advice. With more people entering the healthcare system under the Affordable Care Act and boomers aging, the physician's office wait times are only going to increase over the next 10 years. Office visits and primary care docs will raise from 462 million in 2008 to 565 million in 2025. If there's one thing I want to leave you with, it's the fact that we operate our businesses in a world that allows us to engage our customers like never before. We have the opportunity to engage in meaningful, inspirational, and thoughtful ways. As professionals that are creating, inventing, producing, and providing some of the most awesome health-related products and services, I wish all of us well. Coming together is the beginning, keeping us together is progress, and working together is success. Thank you very much for your time.